Good morning, everyone. My name is Dr. Pedro Falcón Cortez. This presentation will be about landscape of germline BRCA1 and BRCA2 variants in breast and ovarian cancer in Peru, an original research article. Breast and ovarian cancer are two of the most common cancers among women worldwide. In Peru, these cancers are also leading causes of cancer death in women. BRCA1 or 2 variants are genetic mutations that can increase the risk of developing breast and ovarian cancer. These variants are more common in some populations than others, and all of these is are what we are going to talk about in this video. Breast and ovarian cancer are highly prevalent malignancies in Latin America. Detecting BRCA1 and 2 mutations allowed crucial decisions regarding cancer prevention or risk reduction. Early detection and pharmacological management are also important. PRP inhibitors have been developed to treat patients with breast, ovarian, pancreatic, and prostate cancer with BRCA1 and 2 mutations. In Peru, there is a gap in information about the genetic epidemiology of breast and ovarian cancers, and that is why this study is very important. The study includes all breast and ovarian cancer patients referred to Oncogenomics Laboratory in Lima, Peru, from 2019 to 2021. 25 candidates for PRP inhibitors treatment. The histological tumor types, hormone receptor, and human epidermal growth factor receptor 2 status were also recorded. Also, we use next generation sequences to detect mutations in the BRCA1 and BRCA2 genes in Peruvian patients with breast and ovarian cancer. We use the AmpliSec BRCE panel and AmpliSec library plus two prepare libraries that were sequenced on the Illumina MidSec platform. We obtained an average of 95.7% on target rates and 96.6% rate uniformity. In short, the authors use a variety of tools and databases to annotate and interpret the genetic variants and to classify them as pathogenic, like pathogenic, VUS, or benignic. Benignic variants were not reported. Also, they use statistical software to analyze the frequency and distribution of BRCE1 and 2 variants in Peruvian patients with breast and ovarian cancer. In this study, they include 525 patients, of whom 143 had breast cancer and 382 had ovarian cancer. The prevalence of patients with pathogenic, likely pathogenic germline variants in BRCE1 or 2 was 90%. VC patients with BRCE1 or 2 variants were most likely to have triple negative breast cancer, while OC patients with BRCA1 or 2 variants were more likely to have high-grade serous carcinoma. In conclusion, the prevalence of BRCA1 or 2 variants is high in fertility patients with breast and ovarian cancer. Patients with BRCA1 or 2 variants are most likely to have aggressive subtypes of cancer. This study identified 33 different PLP germline variants in the BRCA1 gene in 64 patients, of whom 20.3% had breast cancer and 79.9% had ovarian cancer. The most frequent variants were C.2105DUPT, C.6869DEA AG, C.140GT, and C.815A24 DUP AGCC80GTGG. One new variant was identified, BRCA1 C.2344 DUPA. This study suggests that there is a high prevalence of BRCA1 variants in Peru patients with breast and ovarian cancer. The most frequent variants are similar to those reported in other populations, but there are also some variants that are more common in Peru. Identifying BRCA1 variants is important for genetic counseling and risk management. These patients with BRCA1 variants may be eligible for preventive measures such as increasing screening or prophylactic surgery. Besides, this study identified 22 different PLP germline variants in the BRCE2 gene in 36 Peruvian patients with breast and ovarian cancer. The most frequent variants were C.8023AG, C.6024DUPG, and C.9235DEIG. Different variants were mainly observed in exon 11 and were predominantly in framed elections. Patients with PLP variants were born primarily in metropolitan Lima, Tacoas, and the Highlands. This study suggests that there is a high prevalence of BRCA2 variants in Peruvian patients with breast and ovarian cancer. Identify these variants is very important for genetic counseling and risk management. Finally, this study identified VUS in 7.23% of Peruvian patients with breast and ovarian cancer. The most frequent VUS were found in BRCA2, followed by BRCA1. Most VUS were reported only in patients with ovarian cancer and occurred in exon 10 of BRCA1 and exon 11 of BRCA2. Several VUS had conflicting classifications within ClinVar and the ACMG guidelines. VUS can be challenging to interpret as it's not clear whether they are pathogenic or benign. It's important to discuss VUS with a genetic counselor or other healthcare professionals to understand the implications of the risk it takes. That is why it's important to highlight this part of this study. This study concludes that they found that 14.7% of breast cancer patients and 20.7% of ovarian cancer patients in Peru had BRCA1 or 2 germline mutations. The most frequent mutations were BRC1 C.2105DUPT and BRCA2 C.8023AG. Three others BRCA2 mutations were not previously reported in Peru patients, and one BRCA1 mutation was a novel mutation that has not been previously reported in any database. Identify gene BRCA1 or 2 variants is important for genetic counseling and risk management. Patients with BRCA1 or 2 mutations may be eligible for preventive measures, such as increased screening or prophylactic surgery. They may also be eligible for targeted therapies such as PRRP. And that is everything for this paper. I hope you found it very interesting. Uh, Thanks for your attention.